next up we have Dr. Michelle Gibb. And Michelle's going to come and talk to us about the Wound Innovation Cooperative Research Centre. She commenced in February 2015 as its clinical director. In this role, Michelle's responsible for leading the development of the Australian Wound Innovation Centre, the Australian Wound Registry, and credentialing of wound clinicians' portfolios. Prior to her current role, Michelle led the Wound Healing Service at QUT as the Wound Management NP. She's got extensive experience in wound management and has worked in a broad range of settings. She's had numerous prestigious awards, including being awarded a Churchill Fellow in 2010, and she completed her PhD on wound management under Glenn Gardner about two years ago. Yeah. So I'd like you to welcome Michelle. Take it up to
Hi everyone, thanks very much Chris for inviting me to present here today. I actually kind of feel like the odd one out, not being directly employed by Queensland Health, but I think the opportunity to present here today is one that I'm very grateful for, because working for the Wound Management Innovation Cooperative Research Centre is really all about developing collaborative relationships with a broad range of providers nationally to try and make a difference for patients with wounds. So we all know that we have a growing population, aging population in Australia, and we know that the incidence of chronic disease, as our speakers earlier have pointed out, increase with age. What you may not know is that 450,000 Australians are estimated to suffer from a wound at any one time, and yet the true incidence of people suffering from wounds is really not known, because many people think that it's a normal part of the ageing process. In fact, how many people in this room would treat people with chronic wounds on a regular basis, or know someone with a chronic wound? So pretty much 3/4 of the room. The alarming thing is that the cost of treating chronic wounds to the Australian healthcare system is estimated to be more than $3 billion. But that's only the direct costs associated with the healthcare system, not the costs associated for the individual patients and carers, or in the primary healthcare setting. Just to give you some background, some epidemiology on the problem of chronic wounds in Australia, diabetic foot conditions alone, it's estimated that every 3 hours in Australia that someone loses a lower limb because of diabetes-related complications, and that globally a limb is lost every 20 seconds. What you may not know is that diabetes-related complications are the leading cause of non-traumatic amputation in Australia, and that 90% of them are avoidable. Alarmingly, 50% of patients that lose a limb because of diabetes-related complications lose their life within 5 years after their first amputation. So the discussion before on prevention being a pound of cure is very accurate for this patient population. For chronic wounds more broadly, it's estimated that up to 70% of patients with chronic leg ulcers will have their wound for 15 years or more. And that for those patients that have their wound for that duration, around about 70% will recur within 3 months after wound healing does occur. And that the cost terms, as I said, was almost $3 billion. It's estimated that in Australian healthcare facilities that 50% of patients have a wound, that 3% of the over 60 years population in Australia, the UK, the USA and Europe have a leg ulcer, and that 70% of patients have recurrent leg ulcers. We know that patients are frequently hospitalised through our emergency departments for treatment of their leg ulcers, mistakenly often because it's seen as cellulitis or an exacerbation, and not in fact because they're recognising the underlying disease process. Even more alarming is the fact that patients, once they are diagnosed with a wound, never receive evidence-based practice, and there's lots of different reasons for that, as we'll talk about in a moment. It's alarming that one study in Australia conducted almost 10 years ago showed that 25% of residents in aged care facilities have a wound. More recent studies done by the Wound CRC have shown that it's up to 50% of residents in aged care facilities, and they're ranging in wound type from simple skin tears right through to stage 4 pressure injuries. We know that skin tears account for the third largest common category of wounds in public hospitals, and nearly all of them are preventable simply through the application of a moisturiser twice daily. We know that 90% is the number of hospital and bed days that can be reduced by early intervention, but unfortunately in Australia, we don't have a healthcare system which is set up for preventative management or community-based care for patients with chronic wounds. Prior to the removal of the Medicare item number for wound care in general practice, wound care was the number one most frequently performed task by practice nurses and the second most commonly billed item. The number of patients now being treated with wounds in the Australian primary healthcare sector is really unknown because those figures are now hidden within other practice nurse incentive payments and things. We don't know how many patients are self-caring for their wounds in the community. We see a lot of patients that are very disenfranchised because they bounce from one health service to the next or one health professional to the next. Often they're seen by community nurses, GPs, hospitals, and then resort to self-care because they're not satisfied with the care that they've been receiving in our healthcare system. We know that a broad range of health professionals look after patients with wounds, but wound care is unlike many other disciplines in that it's not a recognised medical specialty. It's not like cardiology or vascular surgery or any of the other ologies. Wound care can be done by any health professional. It predominantly is done by nurses, but in actual fact is done by a broad range. What we know is that 30 to 40% of patients are not receiving best practice, and this significantly impacts on wound healing outcomes. So the Wound Management Innovation Cooperative Research Centre is funded through the Commonwealth Department's Department of Industry, Innovation and Science, and it was established around about 6 years ago to try and, as a response to this growing epidemic of wounds in the Australian population. Initially, when the Wound CRC was set up, it was focused very heavily on research, looking at what kind of research could be done to improve patient outcomes. In the last 18 months, we've changed our focus significantly to creating things that are going to have long-lasting legacies to benefit the Australian community. And that's what I'm really here to talk about today. The Wound CRC is a cooperative research centre, so we have 21 participant organisations nationally, ranging from universities and other institutions through to public health services and other industry partners. The benefit of having such a broad range of partners is that we're able to work together to try and solve the wound problem much more innovatively than can be done just by working in isolation. So Wound Innovations is a new patient-centred health service which has started just here in Brisbane. Our goal was to establish a world-leading patient-centred, evidence-based specialist wound service that would ensure that all Australians, regardless of where they live, have access to the expert care that they require. We know that there are wound clinics often attached to public hospitals. There are wound clinics which are set up in some community nursing organisations, but still patients find it very difficult to access specialist wound care, and particularly wound care which is delivered by more than just one discipline in isolation. Some of our values in setting up the service was to strive for excellence, to ensure that our clinical practice was evidence-based and patient-centred, and was provided by a qualified and experienced transdisciplinary team. We really want to ensure that innovation is fostered through a collaborative research, continuous quality improvement and a learning culture. At the outset, our goal is to attract the best and brightest, most compassionate and caring staff that can contribute to improving wound healing outcomes on the world stage. And I believe that we've achieved that through the combination of the clinical team that we've compiled together. Our service, I was cautioned very carefully once we started this service not to call it a nurse practitioner-led service because it would have very poor implementation and uptake in the Australian community. But it is a nurse practitioner-led service, and we do working within the service model, and our goal is to actually attract more nurse practitioners and nurse practitioner candidates as our service grows and the needs of our patients demand that expertise from a range of highly skilled health professionals. We have registered nurses and enrolled nurses, and what we're really trying to demonstrate through our service model is that we have a career pathway or career trajectory that can be used for nurses. The benefit also of using this model of service and incorporating a transdisciplinary environment is that we're recognising that wound care can't just be done by one discipline in isolation, that we have to work collaboratively with a whole range of different health professionals because the patient with the wound is really the call to action. They come with a whole range of associated comorbidities and lots of other problems that need to be dealt with by a range of health professionals. And by having specialist consultants, GPs, allied health professionals and highly significant goal was that we wanted to improve access for patients with wounds, and we do that through a number of different ways. Our clinical services, whilst we have an ambulatory clinic based here in Brisbane, and we can see anywhere up to 60 patients per week through that service model, we also know that not every patient finds it easy to access a clinic based within an urban environment. Our goal is ultimately to establish a clinic in every major capital city or area of high need throughout Australia. Very ambitious, aren't we? But certainly we need to make sure that we're improving access for patients. We're also improving access through our telehealth system. We know that telehealth is it has been used a long time in lots of different areas of healthcare, but less commonly in wound care. We also have an education and training program which hopes to embed education and training and upskilling of the next generation of health professionals as part of our everyday practice. And we have an active research program predominantly focusing on health economics at this standpoint, simply because we know that we need more data to generate evidence to lobby the federal government to improve access to healthcare services which are subsidised for patients with wounds. So, for example, things like compression therapy is a considerable barrier for patients with venous disease. We don't have enough evidence currently, or real-world clinical evidence, to show that if we put a compression bandage on someone, we can heal them within 3 months, as opposed to never putting a compression bandage on and then having a lifelong wound. It's surprising that common sense is surprisingly uncommon. We mostly see adults at this stage over the age of 18 years. We see wounds of any etiology. It doesn't particularly matter what kind of wound that you have. It's probably easier to say that we don't see those who are acutely unwell. We're not an emergency service, and nor do we want to be. And obviously, where there are existing health services such as burns units, well, obviously it's about making sure that patients access those existing services so that they're getting the best possible care. Our telehealth service involves a really simple solution for telehealth. I don't know how many of you use telehealth, but sometimes telehealth can be a barrier in itself. The telehealth system that we have as part of our service model was designed by allied health professionals who were looking after patients with significant challenges in terms of communication. The telehealth system is honestly dead easy to use. I'm not very technologically savvy, and I can use it, and I know that my patients can use it as well. It involves real-time video conferencing. You basically, anywhere that you have an internet connection anywhere in Australia, you can access the telehealth system. It's a web-based platform, and as long as you have audio and visual ability, you can see and talk to the patient in real time, or talk with the health professionals in real time. For the 26 or 29% of Australians that don't have internet access in Australia, I found that an interesting statistic before. We have iPads that we can loan out to our patients or health professionals, which have a SIM card so that you can access the internet. So it doesn't have to be a barrier to receiving healthcare. The other good thing about our telehealth service is that often telehealth for wound management can be really challenging. You get a photograph sent through and you're kind of working out, oh, is that the head? Is that the foot? Not quite sure where it is. You can literally, on your mobile phone, tablet, internet, take a snapshot of that wound and send it through live, and we can have a look at that wound there on the spot. We can measure the dimensions of that wound and create a digital library. It's all secure, easy to use, and you can create an estimation over time of how a wound is progressing. We also have a national wound advisory service. So very often a patient comes in and has our appointment is 2 hours in duration. The patient will see anywhere up to 4 health professionals during that time, and that same goes for our telehealth service. But we know that often the barriers in seeing the uptake of evidence into everyday clinical practice is that access to ongoing support and advice. How many times have you gone out there to see a patient and you go, oh, I'm not quite sure how to do that compression bandage, I haven't done one for a couple of months. Being able to call someone, whether it's through the telehealth system or on a mobile phone or sending through an email, you can access someone who's able to walk you through that process so that it reduces the isolation that you might otherwise feel. The Wound Advisory Service is a national hotline that is staffed by nurse practitioners and clinical nurse consultants, so that you can talk to someone at any time about the wound for advice and ongoing support. Also, for any education and training programs that we deliver, the participants are offered that ongoing access to the Wound Advisory Service to help them implement the care that they need once they return to the clinical setting. Education and training was really fundamental when we established this service model, because we don't want to be the keepers of all knowledge and skill within our service. We want to share that with others so that we can grow that body of health professionals who have skill and expertise in the area of wound management. clinical placement program, which is based on an interprofessional development model, so that we have nurses, allied health professionals and doctors doing their clinical placements all together, so that they're learning how do those disciplines interact and manage wounds together, so that that breaks down some of those traditional barriers. We also have placement opportunities for health professionals who want to upskill in the area of wound management to come and spend an hour, a week or a month with us learning about how we do things in the area of wound management. We also have online education and training tools, so online modules which can be accessed on a whole range of different wound management topics, which are all accredited through the ACN, RECGP and ACRM, and they contribute towards your ongoing professional development. So it doesn't matter where you are in Australia, you can access wound education and training. We also have a whole range of different workshops that we offer throughout Australia, predominantly here in Queensland. We're going to start in our own backyard to start with, but certainly there are ways to be able to get that upskilling that you need in the area of wound management. And the focus of these workshops is very much clinical hands-on skills development, as opposed to the PowerPoint at the front of the room. So our research and evaluation component is also fundamental to our model of service delivery. How do we create progress in the area of wound management if we don't continue on with our research? The research, as I said, is very much driven by health economics at this stage, and we have 2 research projects which are going concurrently, looking at what is the cost to the Australian healthcare system and the consumer in terms of the cost effectiveness of this model of service delivery, and also in terms of health-related quality of life and patient outcomes. We also have an auditing and monitoring arm, particularly this is where we're asked to go into residential aged care facilities and other services so that they can figure out what is the problem with what is the wound problem within their health service, and what are some ways that we can help them to target and identify what is the most effective way to potentially improve outcomes for their patients with wounds. And also being a specialist wound service, we have the opportunity to often trial and test the latest innovations in wound technologies and products in Australia. And that's really important because it's a way that we can introduce and see how does this particular product that might have been developed in Europe work here in the Australian context, and what is the benefits for our patients. Like any service innovation, continuous quality improvement is absolutely fundamental to what we're doing to make sure that we're achieving the targets that we set out to achieve. And we have a whole range of different methods in which we do that. Some of our performance indicators are really around accessibility. How accessible is the service for our patient population, and also for the health professionals that are accessing our service. We're really seeking to improve the continuity of care by development of a wound management plan, which is developed in conjunction with other health professionals that are managing that patient, but also with the patient and the carers themselves. We're hoping to improve that continuity of care so that plan that patient has developed for them goes to all health professionals involved in their care. We're also looking at measuring the effectiveness of the care that we're providing, and that's not just in terms of are we achieving better wound healing rates and improving quality of life, but also are we using the most cost-effective and efficient use of scarce healthcare resources. We're also hoping to have a responsive service. We don't want lengthy waiting lists. It's important that even though we're dealing with patients with chronic wounds, and it's not uncommon for these patients that access our service to have had their wounds for many months, years, if not decades, and then, there's a perception that these patients don't need to be seen within a short period of time, but in actual fact they do, because these are the patients that end up in hospital waiting, emergency departments and blocking up valuable bed days. We also want to improve our workforce capacity, and we're doing that through education and training, and also through creating a workforce pathway so that nurses can see that this is you can be a professional nurse in the area of wound management. So there's lots of different ways that we measure outcomes, and if anyone wants to know more about the service that we've developed, please, I'd welcome the opportunity to hear from you. I actually need your help, and our service is only as good as the referrals and collaboration and support that we receive from other health services. So please, I'd welcome the opportunity to hear from you.
Thank you. Looks like we've got a question up there.
Michelle, that was fantastic. Dr. Gibb from Oppenheim, Director of Midwifery Certainly this could translate to so many different areas. It's wonderful, but I'm particularly interested in how the patients that come to the service pay for those services.
Yeah, thanks. That's always the first question I get, and I should preempt that by talking about the cost of the service. So thank you very much for asking that question. So obviously we've got a service model which is initially funded through the Commonwealth Department of Industry, Innovation and Science. However, that funding expires in around about 12 months' time. Our goal is to create a sustainable business unit that can continue to provide services to the Australian community. We have to do that through a number of different mechanisms, and our financial modelling is based on above-schedule prepayments for patients. At present, we charge $345 for the 2-hour consultation, which sees, in which time a patient would see anywhere up to 3 to 4 health professionals. Any diagnostic investigations which are performed as part of that consultation, dressing consumables applied at the time of the consultation and the next dressing change. So that's the out-of-pocket fee is $345 both for the clinical services provided in-house and also for the telehealth service. We hope very soon that by conducting the health economics research that we can reduce that out-of-pocket fee to patients. I very well know, like many of you, that most of our patients can't afford $345 for a wound service. And obviously at this stage it's a matter of seeing how that goes in the Australian market. But we had to start somewhere, and we're hoping that the more information that we get on this service model and its effectiveness, that we can use that information to lobby the federal government to seek better reimbursement for wound care.
Any other questions at all, Michelle?
Not really a question, just a statement. I'm Roisin, Director of Clinical Engagement with McKesson. I just want to say thank you. I found your presentation inspiring. You've absolutely demonstrated the nursing process in the role that you carry out, and the fact that your role is a nurse, within the nurse, being kept within the nursing profession is absolutely inspirational. So thank you so much.